Yeah, yeah, I can start. Hi guys, thank you for coming to another scrubbing session. Today we have Dr. Stover here. You guys can enter your questions in the chat and we can go through and read them out and you can answer your questions that way. So I'll kind of let her introduce herself while you guys just type in some of your questions.
It's great that you guys are able to take some time and are showing your interest in thinking about a healthcare career. And so you can tell by the gray hair, I'm an old lady, and I started my health career actually as the daughter of a veterinarian and helping my dad out. But I didn't want to have patients that couldn't talk to me and would bite me. And so my dad and I was an ongoing joke through the years until I had a patient who couldn't talk and then bit me. And I called him up that night and said, Dad, oh, guess what? But I was fascinated by how bodies worked and then became more fascinated about how people work, which is a whole different concept. So I went to college at UMD, the University of Minnesota at Duluth campus. Then I went to medical school, the main house in the Twin Cities, and then spent the next 28 years. Well, I went to residency in Duluth, and then the next 28 years in Grand Marais as a family doc in the Sawtooth Mountain Clinic, which is a federally qualified health center, community health center. And came down to the campus. I'm now on the faculty at the medical school on the Duluth campus. 2 years ago, I enjoyed teaching, and it was time for my old brain to not take call anymore. And we were lucky enough to have a young, just out of residency partner come in, and it gave me an opportunity to think about, evening out the practice made sense at the time. So that's sort of my path. And I did not get bit hard. It was an inadvertent bite that I had working in an emergency room. Working for my dad, I got bit a few more times. So in terms of difficult situation that I had to experience during a shift. So one of the things about healthcare is when you do primary care, that means a lot of different things. And for a rural family doc, you may do primary care as in clinic-based, and you may do hospital care, and you may do ER care, and you may do deliveries. And I did all of them most of my career. And so in terms of difficult, honestly, it was probably more in training in terms of, well, I shouldn't say that. In training, just getting used to things, figuring out how to do them, figuring out how to handle one's personal involvement as well as the professional side of what you're doing. I think in my practice, what was the most difficult day? I actually think in some extent it was somebody that I knew that came in injured, and it was actually the daughter of a friend was also the same age as my daughter at the time. And she wasn't badly hurt, but it was just that approach to taking care of someone that had such a close relationship to what the experience that I would have had I been that mother with that daughter. She was fine. She had actually broke her collarbone. It ended up not being a huge issue, but it was more of again, managing something when you're having to manage your own response to that thing. So for me, and the question is, how does your day typically go? Well, currently I'm in academic medicine, so I'm teaching, but I'm gonna, tell you more about what my regular day in the life of a family practice doc is. Family medicine is primary care. And so the three strong primary care fields are family medicine, internal medicine, general internal medicine, and pediatrics. And all of those share a combination of hospital and clinic-based practices for the most part. There's variations, which you guys may be aware of. Some people do only clinic, some people do only hospital. But I did both in my practice. And then because I worked in a rural area, I also covered the ER, and occasionally we had deliveries. So it would look different depending on whether I was on call to take in extra patients or do emergency room stuff, or if I was on a regular clinic day. But in a regular clinic day, my favorite thing about being a family doc is that I got to see a lot of different kinds of patients. So I could, and literally did every day, go in to see a well exam on a baby, and then somebody who has a chronic healthcare problem, and then someone who young and concerned about a new issue, or someone who's getting close to the end of life. And we would deal with advanced planning and figuring out how best to suit the needs at a different age. So some of those appointments would be a 5 to 10 minute sore throat, and some of them would be an hour long, coordination of a complex multi disease kind of a situation. By multi-disease, people have diabetes, they often have blood pressure issues or renal problems or something else. And so getting that. And then the concept with primary care is that you have a really good comfort level with when to involve your team members who are specialists. So when to involve a cardiologist or a nephrologist or all the people that do other stuff. But I'm very much, I sometimes refer to myself as the golden retriever of healthcare in terms of I got interested in everything. And one of my roommates in medical school went on to ophthalmology, which she was passionate about because she got to know everything there was about the eye. And I was like, that's just like this much. I could just figure, I can't do that. And so I'm just much more, interested in checking out everything. And so that's what made family medicine for me be a really intriguing choice. So biobehavioral health is a big deal in primary care. Family medicine, particularly, looked at this issue not being met as well in medicine about 50 years ago, and that's when the specialty was formed. So the idea of biobehavioral health is a coordination between kind of the mind, body, and I'd throw in spirit in there. And that also then speaks to where you are and who you are in your life and how does that impact your health too. So not just, how you individually and uniquely interact with your world, but also how does your world impact your health? So the social determinants of health is another phrasing for that. And I think particularly in primary care, you spend a lot of time in that world because how people understand and also process their disease is a huge impact in how their experience and potentially their overall health is with that disease. So spend a lot of time there. Also when we can engage partners who could better meet the needs of someone who is struggling past the ability for a primary care person to help them and pick the right person for them. So was that kind of the intent of that question? Okay. But yeah, I think that's the thing about healthcare. And I know you all are not necessarily headed towards a career in medicine in terms of being a physician, but there's a lot of other places. My daughter's in nursing school and she would not have made a good doctor, but she is going to make an amazing nurse because well, actually she wants to do trauma nursing. She's an EMT who's heading to nursing to be a trauma nurse. And that is who she is. And her choices on what's best for her also reflects that. What does your day look like? I think that's a great question. What kind of how do you see your whole career? I think that nursing is a wonderful direction to go for a lot of people. There are some opportunities there to be within one career to do a lot of different things within nursing. Physician assistants, another good partner in the healthcare team. Physical therapy, occupational therapy, we forget about those two, and the incredible work that if anybody here has ever had an injury, you saw a physical therapist, I'd be willing to bet. They're specialists in how to get that body part working again, and OT, how to make it functional again. I think this is a good question. So Shabbat put out, how do you deal with the stress of being responsible for others' healthcare? And I think that is not so much responsible, but partnering with. And there are times when all of us also don't feel like we did the job we were hoping we could do in the middle of something. And then you have to process that with your partners, your friends, the right people that help you process how does that balance out with the choices and the choice you made to do the best job you could do given what you had to work with. I think that's also, the true of any specialty, any job, is that you have that stress of being responsible for something. And when you're for other people's health, I think, again, it is physicians don't so much as take care of directing people's health as figuring out a way for people to take care of their own health with the tools that will make them most successful. But COVID has been kind of you guys might have noticed this thing, this pandemic we call COVID. I think it will change healthcare just as influenza 1918 did, just as not the invention, but the final discovery of antibiotics did. Sometimes the things that change are forced because I don't know how much you guys are into vaccine biochemistry, but the very fact that we have the coronavirus vaccine itself was done because they looked in an entirely new area of vaccines, which will change vaccines and how we look at them forever. And that's an amazing thing. So I think it will change, and I think there's opportunities for it to change. We've had I don't know if you guys think about something called a syndemic. I mean, there's more than one thing going on at the same time, and they all need attention. And so looking at healthcare again is more of how are we serving everybody, and how do we meet people where they are, and how to bring them the best care that we can, given who they are, and where they are, and what they want. And anti-vaxxers would be an entire hour. I think it's important to remember that anti-vaxxers have a belief system that they're passionate about, and that is when you have your baby, your amazing, adorable baby right in front of you, and you're given something that you have to sign off or release that something bad could happen by this vaccine. It's considered an invasive procedure because it enters the body. And so there's, in medicine, you have to, anything that you do invasive, you have to have somebody sign off on. It's scary. And I think that that's important for us to recognize that anti-vaxxers aren't sitting around thinking, how can I make the world come up? I'll be an anti-vaxxer. No, they have a reason. And so I think it's important to not necessarily meet that passion for their child by facts. Sometimes we have to equally match the passion for how to make their child's life better by living in a world where vaccines can be a common thing for all of us to use. So that's what I would say about that. I think it's a good conversation that people are having. So the advice for students who are looking to be more competitive as an applicant, this is hard right now. So one of the most important things is to have experience with of somebody in the healthcare field that could help you walk through that path of is this the right thing for you, and so you understand what your interests are, but also understand what you can bring to the field. And if you have opportunities to talk even by phone with your own provider, if you have opportunities to work within the healthcare field as a CNA or as an EMT. So CNA is a certified nurse assistant, and then people call them different things in different parts of the country. But basically, the folks that are nursing assistants, often within care centers, can be, sometimes find them too in sometimes ERs will use them, or emergency medical technicians, or working as a scribe. You guys are so much better at typing than I am. And so scribes are people that do the transcription of whatever's going on to minimize the provider having to stare at a computer when they should be interacting directly with the patient. I think read. There are a number of good podcasts too that are out now in terms of different specialists who posted, what's a day in life of a but I think it's important to talk to people too, so that you have an ongoing conversation. Number of good books out there too. But yeah, kind of tasting it that way as much as you can. Once COVID is done, I think there'll be again more opportunities through college programs to do some shadowing. I would also say travel when you can, when that is allowed again, or look close at home for a service opportunity. How can you help your community? How can you get to know on a community that's not your community? How can you interact with people one-on-one basis? And what does that feel like? Does that answer that? We have a lot of opportunities right now too for that kind of thing. And again, whatever age group you like to work with will also sometimes tell you is that if you love to babysit, work as a volunteer somewhere with kids. This coming summer, there'll be opportunities for some of that, kids programs and stuff, that kind of thing. So physician's assistants and nurse practitioners are part of the team. I think there's a balance in terms of where are they the most effective? And I think that, again, as part of a team, I think it's harder for both NPs and PAs to be by themselves out in clinics, although generally in Minnesota, the licensure is such that there's somebody else working with them in a I can call them if I need to kind of a role. And it's kind of interesting. Different states have different what's called scopes of practice for different providers, and so it kind of depends on your state how they're used. But physician assistants are pretty good at doing the kind of walk-in, I don't feel good, triage, manage and consider triaging. Physicians are kind of trained to look at things in a little bit broader perspective, not just of what's in front of me today, but what's this going to look like over time, and where, again, is the person coming from, and how can I coordinate what's going on. So nurse practitioners are kind of in between and have a different tradition of training, but tend to, again, focus a little bit more in one area. Although I worked with an amazing family practice nurse practitioner who was very good, and she limited her focus to clinical only. That's a real common thing for nurse practitioners, to have a focus on one area, or just do a cardiology nurse practitioner, or just do something like that. Misconceptions about the profession. I don't know, because I try to think about that. That's actually okay. I'll challenge you guys, because these two are the only ones asking questions. What is your expectation of what a physician career is like? What's a conception? And I'm not going to say if it's miss or not until you put it in there.
The chat is disabled, just so you
guys know. Oh no. Yeah.
Yeah, that's why no one has been doing it, I think.
Can you enable?
There it is.
Hello. And I love seeing faces too, but you don't have to, because I know they're not all in a position where you want to be showing where you are. If you're laying on the couch with in your jams. We have actually gone online for more of our medical school than we have now. Thank you, Ingrid. And so I was kind of chatting with my group one day about, come on, you guys, I love seeing faces, and I got this only if you want to see me before my shower. Like, oh, I get it. Where you want to be. Ingrid, did you have a question, by the way?
Not one that I can think of now. I just wanted to let you guys know the chat was disabled.
I appreciate it.
Mm-hmm.
I appreciate it. I think the biggest thing probably for anything in the healthcare field is if you're a curious person and you want to know a little bit more about something. That is one thing about healthcare, is it's changing all the time in terms of what we understand and know about it. And so you need to have that curiosity, that comfort level with satisfying your curiosity by reading and keeping up to date. And there's a lot of continuing education, but there's also a lot of opportunity to learn as you go from your partners and your teammates across the sort of age span of healthcare providers. Just when you think you know everything, they come up with something new. And it's been interesting from coming back to my job now in a medical school, is they invented an immune system since I went to med school. There's all these cells and stuff. When I was in medical school, it was a lot of years ago, but it's just a sign of how much more we have to learn about. And many physicians do research, so that can be an opportunity as well, either community-based if you're in primary care, or generally just community-based research, or bench research if you're in more of one of the specialties. And so that's another opportunity to apply both what you see within your practice and what you want to know more about, and applying research techniques to that. So most of you will, to be competitive in medical school, need to have research in your background. And it could be from one of your research classes, one of your science classes. It could be a summer research project. If there's a medical school near you, there's usually research there that's open to interested college students to be involved with that. Other questions? I always feel like I could literally talk for hours and drone on, but I'd rather drone in a direction that you guys are interested in. I actually just today I had a couple of application interviews. And so, I mean, a day in the life, Ingrid, we talked a little bit about in terms of what my day was. I didn't really say what my day was. So I'd, get up, do some prep chart stuff so I could see who was coming in and get an idea what they might need. And my nurse and I would sort of plot the day out. And in that, some people we knew would take a little longer and some maybe a little shorter, and she'd get stuff ready for me so we could get through. Lunch was usually, a quick break, but also time to catch up on phone calls. And then if I was seeing patients in the hospital at the end of the clinic day, I'd go back. I like to do my evening rounds in our hospital was right glued to the clinic. So I go in the morning to figure out what they needed to do for the day, and I go at night to see how they were doing and sit and chat, because my load of hospitalized patients was not as heavy as my clinic load for the most part. That's a good question from Janet about balancing practice and continuous learning. I learned from every patient I saw, and sometimes they're just confirmation, but other times it would be having them see a specialist, and I'd learn about, because the specialists were always really good at putting out their reasoning in their note, partly for themselves, but I learned from that as well. And then going to conferences, that's one problem, honestly, with the virtual world is 3/4 of going to conferences, also checking in with your partners and your other team members that are in your specialty, and sitting with as a group and talking about what's going on in medicine, and learning new things was just fun to me. But you have to have that curiosity to wonder what's next. And lots of good podcasts on healthcare issues that you can listen to while you're exercising or something. It's not that hard, but it takes that little bit of, I wonder what's going on. I would really like to know a better way to treat this, and then looking it up is I think part of what drives a lot of people in healthcare. So in terms of anxiety, that is actually interesting that there are more recorded folks who admit to anxiety in the last 20 years than there was in the preceding 20 years. And anxiety is one of those things that sometimes can actually be an element to keep you sharp in a way, if you can balance your anxiety. But what it really takes is somebody being comfortable and finding those tools to use the anxiety in a way that helps them keep sharp and focused. I think it also probably is not a place where you would want to be in a more high anxiety level area of medicine. So being an ER doc and having anxiety is probably not a good combination. But there are other parts of healthcare where that could, and even in that very field of researching anxiety, who knows better what's important to know about that than someone who's had to help manage it themselves. If somebody, this is a good question from Dinesha, I hope I'm saying your name right. If someone had interest in multiple specialties, would you recommend them pursuing med school still? That's called family practice. I'm only kind of half joking. Family medicine gets a lot of that, of people interested in lots of different things. PA and nursing, I think the flexibility, when you say you're interested in multiple specialties, I don't know that you'd get any better approach by being a PA or a nurse, because they generally go to an area where they sort of have more of the same kind of focused care area. But I think what PA and nursing does is gives you a little bit more flexibility because you don't so much have, it depends on the place where you're working, but PAs and nurses can be more flexible in the kind that they do. So a PA who works in a primary care place in a rural area could transfer pretty readily to a PA who works in a primary care office in an urban area, and vice versa, because they tend to see acute care, so they can do the acute stuff. People who are PAs or nurses who work in a specialized area, like a cardiology office or neurosurgery office, would have a little more trouble translating. They'd have to retrain a little bit, but it isn't the same of it. Like I couldn't go be a neurosurgeon tomorrow without a lot of retraining. A PA would need some retraining, but again, because they're dealing with the kind of the entry level patient, for the most part, that it's a little more flexible to change positions, jobs, geographic areas, that sort of thing. Being a woman impacting my experience in healthcare. So far, I see mostly women split faces. So if there's men involved here too, take this in context. But women in entry class of medical school now is 50-50 or greater than 50-50, but that's not always been true. And there are certain specialties where women are much less likely to be found than men. So I think there is still some expectation that women are more or less likely to go one direction or another, like all women want to do peds or all women want to do obstetrics. That's just not true. And there's some amazing men who make the world's best delivery partners. But I think that we're well on the way to it being a little bit easier. And I think more women who go into medicine, when you have a class of 2 in medical school, it's 50-50. It is very hard for the men in the class not to appreciate that the women are just as likely or not likely to be good at something as any of their male classmates. But you enter a world where there's a lot of older physicians that are still processing that, particularly in competitive fields like orthopedic surgery and some of those. Oh yeah, family medicine and burnout. Part of that is that I think it depends on where you look at burnout. One of the things that is always a struggle, and I'll come back to women for a minute, is when you are the one who bears the child and is pregnant for 9 months and then has some time they want to be with their baby, that does impact careers. It does not impact it huge, but when you're looking at it, if you're partnered with somebody who's also got a big career, there's got to be some compromise in terms of how do you manage family on top of a career. In terms of burnout rate, I think that's burnout in medicine. And I think it's coming because I think docs want to do more of what they're trained and that they see they would like to do. And I think healthcare systems are struggling to figure out how to balance all that and pay for it. And that's coming back to a reckoning of, healthcare is going to change in your lifetime in terms of how we serve people, serve everybody. Does that make sense? And I think other questions? I'll come back to the burnout thing. There's less burnout if people choose a single thing they do as a family doc. So scope of practice means that family docs are trained to do a lot of different things. So in your training, you are trained to deliver babies and be in the ER and do hospital care as well as clinic. But many people, when they graduate from residency, make a choice to do only one aspect of that. I think the training is still good for like a hospitalist or a clinical only based person, because it's still the idea that training is looking at who the person is within their world. And that's an issue that family medicine is kind of dealing with, because in rural areas, we're the most cost-effective kind of physician provider to have a broad person. Naturopathic medicine there's actually a really interesting history of how medicine was developed in the United States. If you ever have nothing to do when you guys are in the middle of college, and you're like, what could I do? Oh, look into that. In terms of how the different types of healthcare, osteopathy, allopathy, naturopathy, were all in different places. And I actually think there's something to be gained from understanding all the approaches. And so I think that's collaboration is really where we got to go. And I don't think medical school will ever be online completely. I think there's opportunities to do a lot, but there's excellent literature actually that doing cadaver labs and using anatomy with a set of donated bodies is actually better than trying to do it online. And there's a lot of reasons for that we could go into, but I also think that it's when you train with other people, you're training for a team sport essentially. So it'd be like, yeah, you could learn how to play tennis online. There's lots of videos, there's lots of things. You go practice it out in the backyard, but you don't learn about I should have said soccer. You don't learn about it without learning in a team-based setting. And part of that too is the discernment of what kind of medicine calls to me. So if you go to medical school, you don't have to know that you're going to be a neurosurgeon. What you do have to know is that you're interested in learning more about being a healthcare provider. And that's an opportunity to work with docs at a different level when you're a med student to discern which part of medicine calls to you. And family medicine just rocks and it's the best. So that's why I went into it. So, because I'm a golden retriever and I'm interested in everything. So that's why I went to that. But so DO and MD are similar in many ways in that there's very similar training on illness and the development of illness and also prevention and wellness issues. But there's a different approach in DO school to looking at the body as more of an integrated thing. And part of that is they're taught the body in a slightly different way, and the integration of doing adjustments to help a body that's out of alignment. And so it's not chiropractic and it's not massage therapy. It's kind of its own unique thing. So DOs and MDs work very well together, and you'll see DOs who do no manipulation, and you'll see family medicine docs who learn some, but overall the training has a different focus. And look up at the history between MD and DO, and it has to do with how medicine was born and raised in the United States back in the 1800s. So the interview process, good question. In terms of going online after COVID, I don't think it'll be completely online, but it might be an opportunity to do a 2-tier. So you could have an interview or sort of a virtual visit, and then you need to see the building. You need, like all you guys before you chose your colleges, If you had not been able to see your college, would you have wanted to really engage in going there without knowing, did it fit? Does it feel right? Can I see myself here? It'd be hard. Just like part of college is learning how to be independent and work through things on your own and figure out, you couldn't, there are many just online universities for people, but it's not the same experience. The interview process, there's if anything about that, I don't know how many of you are close to thinking about that, but there's lots of programs you can do to kind of practice and all that in terms of doing the interview. For if you're going to interview at a school that specializes in being more research oriented and stuff, you may want to do a little bit more. Well, I shouldn't say that. I think it's really important to understand that medical schools look at a application fairly holistically, as who is the person as well as why do they want to go here. And so being yourself at an interview is honestly the best thing you could do. Present who you are and why you're interested in medicine, but not feeling like you have to plan what you're going to say. That becomes very, as you know, any time you've interviewed for jobs or whatever, if you can just be who you are, you'll do much better than trying to be something that you think the school wants you to look like. That's one of those medical school interview questions. What's a piece of advice you wish you'd had earlier? What is a piece of advice? I had a great career. I've a great career. I've gotten a chance to do a slightly different version of it in terms of going back to teaching. And it's just, I love teaching. I loved it when I was in clinical practice too. I'll tell you, when we were in residency, we avoided all of the presentations that were about how practices work together and how you also, not only do you have to pick the school that works for you, you have to pick the practice that works for you. And so what does that mean? It's not so much, it's not like speed dating. You don't want to just superficially know who you're going to join, but when you join a practice of people, you're going to share patients with them and you have to share a philosophy with them. And so I think that would be the biggest one, is don't avoid those supportive opportunities to learn how to be finding the right place for you as you move forward. You've picked out your specialty, you're done with residency, you're going for your job. Think about not only what you're going to bring to that job, but what is that job going to be like for you, and what can they bring to make it a right experience for you. So I went into medical school knowing that I was not going to be a surgeon, even though my dad would love surgery as part of his job as a vet. No, it was not for me, for many reasons. But I liked the people part of it, and so I figured that no, probably not a specialty, because I wanted to see people more. It sounds kind of funny, but I wanted that part of it. So I just couldn't decide when I first started medical school if it would be peds, OB, or family med. And I dropped OB pretty quick, not because I didn't like delivering babies. I loved it. It was a wonderful part of my practice. I just don't want to do C-sections. Or when you're gynecologist, you do a whole bunch of gynecology surgery, which once again would have made me be a surgeon. And that was not how my fumble fingered. I actually like doing procedures, but not surgery. And peds, they have to stop seeing their people when they hit 21. What's up with that? So I would have not had the end of the story, and that would have driven me nuts. So it came pretty quick to family medicine being cradle to grave was just more fun. I had one student in my class of med school dropped out the second week we were there. And I think what it was is that he'd worked so hard for a dream and a vision that he had, that when he got there, he realized he wasn't that interested in pursuing it. And it wasn't the coursework. We were only the second week in. It was that he realized that he wasn't excited to be there. He was excited for the journey, but what he was really excited about was probably more research, I think. We had a big class, but I remember him dropping out right away, and it was not the degree of work. So I think that's the big thing, and why spending time talking to people who do the work, observing, shadowing when you can, or being a scribe or something, to see is this a group of people that you could see yourself spending a lot of time with? By that I mean providers. And are these the kind of patients that intrigue you and make you curious? And that's what you want to know before you spend a lot of effort and energy and literally finances applying to multiple schools for medicine. I did not see a lot of people drop out during medical school. other than that first week. What else happened though? For me, I've seen a few people over time change their professions because for them, they realized that but there was one in the practice a few years before I got there who was a family doc who went back to residency, became a cardiologist because he realized that's where he loved spending time thinking about that whole vascular system. And so that happens too. That's why discernment is so nice, is spending time with different specialists to go, can't spend all that time in the eyeball because it's only that big. I can't do that. So that's why. If you guys are thinking about applying to school, go on their websites and look at their mission statement. See if you can, and some of them will have previous students that'll talk. Are they the people that, again, that you think you could hang out with and they'd be fun? Because those are the kind of people that the school will tend towards producing. And when you spend time at a medical school, it's helpful to know that you share this a similar vision. Is it more of a doing underserved work, where our school in the Duluth campus focuses on rural and family medicine and Native American health. So look at the mission statements, just like you do in your college. Does this look like a place that I'd like? Drive in them if you can, but in this virtual world, talk to the admissions offices, just see what they would recommend for their individual schools. Finances are a thing, so it's often easier to apply within the state that you live in, because state prices are less than out of state for the most schools. Does that make sense? But almost any medical school you go into is going to do just fine for you because they'll give you the opportunities to discern. It's the residency that will be literally, you are not applying to a residence so much as you are having the residency apply to you to know, is this the right residency for you? And that's again about personality. What's the family practice residency in Duluth is training rural family docs. Do all of the people who graduate go into rural family medicine? No, but it's a more kind of holistic approach to training a general family medicine track, and with some other tracks for people who are interested in sports medicine or OB. So that's kind of what you want to look at, is what kind of family medicine or what kind of neurosurgery sort of thing does this group honor? That's their goal to produce. Most memorable patient interaction. I had a lot of them over the years. In different times of my life, they were memorable for different reasons. One of my favorites, though, was the first summer I was in Grand Marais, which is, for you that don't live in Minnesota, it's a relatively small town. So our hospital was small, 9-bed hospital. And so I was doing the first delivery that I had done. And it wasn't someone I had followed through their whole pregnancies. It was only a few months after I'd gotten there, with a nurse who was brand new too. And so we're doing this delivery, and the mom this was her second child, so she kept telling us what to do. And then her 8-year-old son was taking pictures during the process because she'd assigned him a task. He was like 7 or 8. And it was the most wonderful thing. It was like we were all working together on this. It was just lovely. And I still have the picture of that baby that I keep in my office. So that was just one of those fun ones. But yeah, I think the other ones, as I got out of my practice, were taking care of multiple generations. So I have a picture of a 4-generation family that I took care of all of them. And so it's just fun being part of people's stories. Misconceptions about family docs. The biggest one is that if you're jack of all trades, then you're master of none. But I'll tell you guys that the other part of that saying is, and people don't think about it, but it's jack of all trades, master of none. But isn't that better than being the master of none? And so for me, and my specialty was taking care of people who and their family and their environment. And I think we do the best with that, but some people think it's just sort of coughs and colds. It's a lot more than that. The tips for studying and keeping yourself motivated. And when you're mentally exhausted, you need to go outside and go hug a tree or go hiking or just go sit out and watch the grass grow or get, something like that. I think it's, we sometimes forget how important it is to be outside. And outside can sometimes be outside of yourself, but physically outside is a good thing. And then calling your best friend, and literally calling. Do not text. No Snapchatting. You need to have personal connection. There is something about that personal space occupying, being present for each other, that you really need to think about how you can do that. And it's harder in a COVID world. It's one of the things many people are struggling with right now. but you can go outside, and you can go outside with a friend and walk in ways that you minimize your risk to each other, or pod together in ways that can support you. Making cookies is good. Being creative, having something that you do that helps you be creative. And just realizing that you don't have to be perfect. Most medical schools are not looking for perfection. They're looking at people that understand they don't have to be perfect. Because that's the human condition, you know. So there's a question from Erica about what would you say that by having experience working in a hospital setting could set you apart from other applicants? Many applicants have experience working in a hospital. It's not about what your experience is, it's what your reaction to your experience is. Does that make sense? So you can do anything you want to get in experience with the healthcare, but what about that thing taught you something? So if you're working in a hospital, what did that give you that helped you discern that medicine's the right career for you? So you were a CNA. What was your patient relationship? You know, that kind of thing. I think that's true of any experience. It's not necessarily just the experience, but what is it that it taught you? We almost, I don't want to take up all your time either, but I love answering questions. You've already figured out I can talk endlessly without questions to prompt me. I just think for all of you guys is just, again, to find the thing that intrigues you and interests you and that could keep you filled. And fill the other. You don't want to fill everything from just your career. You want to be able to fill it from your interests, your friends, your family, your dog, the other things that make you the person that you are. So that's the applicant that I want to see too, is someone who has a clear understanding of who they are and what they want. And if you want to work on eyes, because they're this big, the Twin Cities campus is probably a better place to apply. Although we've turned out ophthalmologists off our campus too. So I did not transition from OB-GYN to family medicine. This is Alicia's question. I was a family doc who did OB. And that's been a long-term, general practitioners from the turn of the 1800th century did OB, because that's where family docs would tend to be, is in communities. And there's been a coalescing, so healthcare has tended to coalesce into centers where it was much more spread out. It was much more common for individual docs to have their own shingle that they'd hang out and be a doc somewhere. My mom, their doc definitely primarily made home visits in their community in Iowa. So I think that's part of the story of medicine that's still being told, is what is it going to look like 50 years from now? And that's your generation that's going to drive that. Oh, that's a good question from and I'm not going to say your name right, but Jay Hong, about the most unique experience that I saw in someone's application. There's been a lot. I mean, that's what I think is fun being on admissions, is I get to meet all these people. It's sort of like being a family doc admissions person. I get to meet all these interesting people who do interesting things. Again, it's not so much any one thing. What did anybody do? And honestly, I've been on it now a couple of years, so you'd think I would remember one. The things that most intrigued me were what people thought about other people that they met. What people did they meet? What people did they interact with? Lots of people did really interesting projects that serve needs for community. I've always loved those. Having an idea and making it work. And that idea can be in research, or it can be in you see a need in a community, and how do you meet that need? Those are the ones that intrigue me individually, but I think it's, again, important that you also show how do you know you want medicine? How do you know that it's the right spot, that you're interested in learning more, but how do you know that the direction you're headed is the right direction? I think that's what I'd say. It's actually great to meet you guys, and the ones I love seeing faces, and I get it why it's not always the right thing to pop on the video, but I really wish you guys all the best luck. Again, explore all the different places that your interests take you. This is a great time in college to do that, and wish you could all be in person with each other, but good luck to you.
Thank you.
Thank you so much.
care.
Thank you.
Thank
This is
you.
great. Yeah. I'm really oh, you bet. Thank you, Alicia. It's nice to see faces. It's really nice that you guys are doing this because it has been hard for people to access physicians to talk to. I just talked to somebody who was doing more of a phone access with someone that they knew, and they just meeting every month or so to talk over the phone about what the practice has been doing. So anyway, thanks and good luck with you guys.
Thank you so much.